Hello, I'm Catherine Court.
And I'm Kimberly Court.
And we're the creators of PilatesOnFifthOnline.com and the owners of Pilates on Fifth here in Manhattan. So today we want to talk about how to alleviate lower back pain or lower back discomfort.
Yeah, so this is lower back pain that just comes from overuse of certain muscle groups or underuse of certain muscle groups, like if you've been sitting too long or driving in the car, you slept wrong, something like that, not for disc injuries or diagnosed lower back problems.
So if you're under treatment from a physician for a spondylolisthesis, a herniated disc, spinal stenosis, something like that sounds grave, then don't watch this. This is about just lower back discomfort caused by muscular imbalance.
Right, like you worked too hard. You gardened. You gardened all weekend and your back hurts the next day.
You stood all day and realized that you weren't holding your abs in at all. So, because actually most lower back pain is caused by muscular imbalance or muscular dysfunction. So we want to show you today, we want to show you 3 strengthening exercises and 3 stretching exercises that you can do when your lower back is a little bit wonky, and hopefully you'll find some alleviation. So let's start with strengthening. So Kimberly's going to lie on her back. And so these are all simple, because let's face it, when your lower back is a little bit wonky, you're not going to go do like 40 minutes of a plank or something. So first she's just going to relax, and you know, she's pretty relaxed, and that's good. And actually this relaxed position can provide a lot of comfort for you. So what she's done is she's opened her feet a little bit and let her knees fall in. With the knee bent, this takes a lot of strain off the lower back. Go ahead and straighten your legs fully. This is if your legs are heavy, which most of our legs are heavy relative to the rest of our body, when the legs are straight, it can actually pull the back into a little bit of an arch.
I'm a little bit exaggerating, but this is what happens. I just want you to be able to see it.
So that's not going to be comfortable, especially if your back is bothering you. So just by bending the knees, you can alleviate a lot of discomfort. When you're sleeping, because you can't always control, like you could start sleeping like this, and then goodness knows what's going to happen when you're sleeping. So sometimes you could even put a pillow underneath your knees when you start to sleep, and so that way that'll just take some of the brunt off, the pressure off the lower back. But what we're going to do here is she's just going to pull in the transversus abdominis, which we've talked about before.
What do you want me to do with my legs?
Oh yeah, so she's going to bring her feet together, and then the legs are adducted. And you want to do this as neutral as possible. And that being said, so she's putting her hands in a diamond shape, and so you want your index fingers and your thumbs to be in the same plane. Now, if getting into that position puts strain in the lower back, then bias towards, like a flexion of the lumbar spine. We call it supported position. Some people call it imprint. So if your hands are like this, the index fingers are going to tip higher than the thumbs. And then from there, she's just going to pull in her abdominal muscles. Sometimes the image I use is that if I suddenly were to say, Kimberly, I'm going to step on your stomach, what would you do? You would brace, and you would brace by pulling in. You don't want to brace by pushing out.
That's what I was just going to say. Yeah. So most people will brace by pushing out. So see the difference between here, but you want to brace by pulling in your belly button, staple it to the front wall of your spine.
So it's like that corset, or that we did the image before with a stretch band wrapped around where you're pulling it from both sides. Everything sucks in. So you want to just hold that for a few seconds and then release. And then hold it for a few seconds on the exhale, and then inhale, release. And then you can also hold it there and try to inhale and exhale, keeping that nice strong engagement, so that you know that it's there for you. So that's one way. So now we're going to switch to all fours. And it's the same idea, but now in the all fours position, you're now, instead of pulling in, you're thinking of pulling up. We're going to pull up against gravity here. So first she's going to do what not to do. So let everything go. Right. So we don't want this arch here, right? Like the old gray mare that's been ridden a little bit too long. So she's going to close her ribs and pull everything up. But what she's not going to do is round the other way. We're not trying to round this way. We're trying to keep our spine neutral. It will present itself in a human being like a straight spine. So we can use that cue. And from here, after she lets her abs relax, on the exhale she's going to pull everything in, and notice the shape of the spine does not change. And then relax. And the same thing like we did supine, she can stay there, exhale to pull everything in, and then take an inhale and stay there as well. Excellent. Now if we want to take this a little bit harder, and this is not when you're in the extreme throes of back pain, but if you just like, I need a little bit more kick to this, she'll curl her toes under. And now from here, same idea of pulling up, but now she's going to press into her toes and pull in the abs and just lift up and hold for a few seconds and then come down. And you can feel all the muscles. It's like, image-wise, all the muscles around the spine are shrink-wrapping around the belly. And lift, lift, lift. Good. And come down. Excellent. Now, the third place that we can do this is against a wall. So what we can do, and you can do this seated or standing. Do you want to just do it seated here?
No, I'll stand.
Okay. So we can do this standing. So what she's going to do is she's going to walk her feet out from the wall and then just pull everything in. And so it's almost like image-wise that you have someone here, they're pressing in, and so everything is pulling in and flattening as much as you possibly can. You just want to hold that. This is a great place to practice breathing because you're actually upright where you can still hold everything in and breathe. So those are our 3 strengthening exercises. So now we want to go into some stretches. So Kimberly's going to go back on her knees. We'll start with the hip flexors. So if the hip flexors are too tight, they can pull the pelvis. Go ahead and show what tight hip flexors will do in this position. Oh. Yeah, they'll pull the pelvis this way, which you can see how it shortens the muscles here, and that can be cause a lot of discomfort. So Kimberly's going to bring one knee forward, leg forward, sorry, so she's in a lunge. And then notice how she's keeping this area nice and strong. She's not going to too much of an arch. She's not losing that. So you want to think that your spine stays straight, and then you're pushing your hips forward so you feel a nice stretch in the psoas. If you want to intensify that a little bit, then she'll take her hand overhead, the same hand as the back leg, and do a side bend over.
Now it's very important to keep the pelvis as upright as possible. So if you really lean forward this way, I really don't feel my psoas here, right, but I feel it a lot if I stay nice and up. So it can be deceiving because this might look more impressive, but this actually is where I'm getting my psoas.
And that's where you want to be very, very honest. And it should feel more like a release as opposed to a stretch. We're not actually trying to increase flexibility. When you're in the throes of lower back pain, increasing flexibility is not what we're trying to do. We're trying to restore length that should be there, that is not. So it's more about trying to get back to that neutral position. So it's not a wow moment at all. Yeah, good, good, good. Yeah, and so as Kimberly said, you almost in your mind's eye have to think of tipping your pelvis this way, which is, which is impossible in this position, but that'll keep you nice and stable through your abdominal muscles and also through your pelvis and lower back. So that's stretch number 1. Next we'll go into a glute medius stretch. So we're going to do glute medius and then piriformis, and they are very, very similar. So notice which one is which. So which one do you want to do first?
Oh, you pick.
Let's do glute medius first. So sitting there, she's going to cross one leg in front of her, and then she's going to put the ankle on top of the knee here, and then ideally this knee would be on this foot. That actually looks pretty good. What you do not want to do is you don't want to take your hand and press it down. And so that's why if you're working with someone and you're doing assisted stretches, you let them guide their own body.
Yes, so basically if you look like this at first, that's okay. What you should do though, notice if I sit this way, you can see that I'm really rolled back. So try to get your pelvis as neutral as possible and then start, letting the knees. Gravity helps here. So let gravity do its work.
And breathing. This is where breathing really, really helps. Try to relax
do the
into the
other
stretch.
side too.
Yeah, she's going to go ahead and do the other side. And what I find when my hips are really, really tight, so again, everybody's different, so what's good for the goose is not always good for the gander, but when my hips are really tight, it's usually this guy, it's gluteus medius. That's the problem. The first time I go into the stretch, it doesn't look nearly like this. My knees, well, it's not up by my shoulder, but it feels like it is. So I sometimes will do the right leg and then the left leg and then go back and do the right leg and the left leg again. So you ease into it.
And about 30 seconds is good. I find that most people count to 30 at the speed of lightning. So my suggestion is to count to 60, and you're probably going to be closer to 30. If you go 1, 2, 3, 4, 5, 6, 7, 8, that is clearly not a second.
Right. But these are really, really nice stretches. So then, to switch to the piriformis, did you do both legs?
Yes, I did.
Okay, so then think of a pretzel. We're going to show you a way to do these supine as well. So that way if you want to do it anti-gravity and you want to do a more relaxed stretch, we're going to show you a way to do that as well. So goal being to stack the knees on top of one another. That's good enough. Idea with the hips on the ground, and then that's going to get the piriformis a little bit more.
Lengthen out the top of your spine.
Yep. And if that's not doing it for you, you can lean over a little bit. You can do a little side bend.
And when you lean over, you can just turn your head right and left.
That's a good point about turning the head. If you have so much tension here that you can't turn your head, then you're not letting the relaxation happen. So a lot of times just by relaxing the neck, everything else will
And one more time to show you into it, you cross one leg over, try to get that heel to the greater trochanter of the lower leg, and then kind of ooch around to stack your knees and try to get both sit bones feeling the ground.
And the reason we did the strengthening exercises first is because when you're doing these stretches, you still want the core engaged. You just don't want everything else just like just hanging out there. So she's still engaging her core.
Yes.
So we want to show you how to do these same exercises supine as well. We have a little cushion over here that I'm going to grab for the psoas stretch. So I'm just going to grab that out of frame, back into frame. So what Kimberly's going to do is she's going to somehow finagle her way so she's on top of
you put it this way, right?
Yeah. Oh, sorry.
Okay. I was like, do you want me on the knee or on the foot? Okay.
And so that way there's a little bit of support here for the knee if it's uncomfortable the other way. You can, then we're going to show you one more way to do it here too.
So how would you do that one?
No, go ahead and lie on your back.
Oh, okay.
And then she's going to go into a little bit of a shoulder bridge, and we're going to slide the cushion here. And then she's going to bring one knee into her chest. And then this way we just let gravity take hold and open the hip flexor.
Now you can do this off the edge of your bed. If you prop your lower back, so at the edge of your bed, stack some pillows, put your hips on the pillow, because the last thing you want, okay, pretend this is the edge of the bed. You don't want to be like this off the edge of your bed where your back is incomplete. Yeah. So stack some pillows, then you can hold one leg and let this one.
And it's supposed to be relaxing. If sometimes visualizing like a knot that's in a ball of yarn, like coming loosened or something. That's what he wants to think about. And we'll let you go ahead and switch legs because it's comfortable. And then we'll show you how to do glute medius and piriformis here as well, but I'm going to take the cushion out from under you when you're ready. So she's going to lift up a little bit. I've got this.
Don't do that if your back hurts.
Yeah, your back hurts probably not a good idea. So same position we were in. Just imagine that these are your legs. We're like, it's kind of like a genie. You were here. She's going to do that in this position here. So this would be piriformis.
Oh, sorry. Which one did you want?
Glute medius first, but doesn't matter.
Oh, this?
Yeah.
Okay, so it's like a number 4.
Yeah.
So you put an ankle on the knee. I'm sorry, I misunderstood my dear sister. Okay.
There, and so that way you get one leg at a time. And then she'll do the other leg, and then, yep, from there, feeling the stretch. And you can use this opposite hand to press the knee open a little bit. If the tailbone starts to fly up, you're not getting as much of a stretch. So while you're doing this, if you can think of a tailbone being heavy, it's going to be really nice. And then
another nice thing you can do is just hug your knees into your chest, even grabbing the thighs, and feeling like you're butter in a pan, and just this can really help relax the lower back. Like I find this can be one of the best.
Yes. Anytime thinking of butter is a good thing. Anyway, so now piriformis will cross the knees here. Yep. And there. Let's face it. In both stretches, you're going to get a little bit of glute medius and a little bit of piriformis. We're just separating a little bit because they look a slightly different. We're trying to mirror what we did seated. And then switch.
And notice I'm grabbing the ankles and indicating them coming towards me. I'm not yanking.
Right. And what you don't want to do, if you feel any pressure or anything weird in your knees, stop. It's not supposed to be about, we're not supposed to get the mobility in the knee. We're supposed to get the mobility in the hips.
And I've done an underhand grip to keep the shoulders open. You could grab this way, but most people tend to do this. So underhand allows you to keep the shoulders nice and open.
Yeah. And that is how to alleviate lower back pain and lower back discomfort.
Thank you.